show the audience the operation area. Ultrasound, scan, and
好，消毒吧。
net area.
好，我们首先消毒，好吧？消毒你会讲的。消毒。
Sterilization first.
Is it 可以，好，因为你在这准备操作机器，这边，啊，没事，好，可以开始，好，消毒。
Now the doctor prepare to do the procedure in the operation room. Okay, show us the patient how to do the first step, the sterilization. Focus the area, please. Yes. Hello, Dr. Chen. Dr. Chen, can you hear me?
Yes, we can hear you.
来看得到。
I want to know Dr. Chen, so introduce the case, please.
Yes, so we just do the puncture point disinfection, and now
Want to do the
next time
puncture,
we'll
the puncture,
we'll do local
final
anesthesia.
needle ablation. You want to do the final needle ablation for the case?
Sorry,
Aspiration? Final needle aspiration? Or do the procedure microwave ablation?
已经做过了。
we already do the fine needle aspiration, so we'll do the case
Already
directly.
done. So
Yeah.
That means the fine needle aspiration already done, right?
Yes.
Last week 上个星期。
I
we
mean
did it last week.
Yeah, just introduce the case
Okay.
briefly.
Okay. So
对每个结节都做了活检啊，3个结节啊。
Do you mind introduce
now
the
we
case
do ultrasound
briefly? Okay.
to check the nodule position.
Through FNI, we find this nodule. This nodule is parasitoid adenoma. Because it's the aspiration examining the parasitoid hormone is rising. 哎，麻药。Before ablation, we CUS these nodules， 把那个雕出来，超声照影看。OK， 对。你对着这个屏幕可以看一下。啊。我没播放吗？ 没录，我这是录的吗？我们什么都没 OK， 刚做啊 OK 去掉吧。好，对 OK， 我们首先这个打个局部麻醉，好吧
？Now we do the local anesthesia.
OK。我们首先消这个下级的这个甲状旁腺腺瘤啊。对 ，hyper
Yes,
dissection.
now we inject saline to build a water isolation area.
So, are we gonna ablate the parathyroid adenoma first?
Yes.
Okay.
Now the injection the fluid, right? Separate the tumor with the tissue.
Yes.
它
Yes.
什么情况？我们
To
精液
build
全
a
部放在
water
手术上面
isolation.
啊。你弄好了没有？你大头等着我。我要暗一点。OK。这里盐水对不对？
Can you please tell us what is the size of parathyroid adenoma?
Yeah. The maximum is 20 millimeter.
20 millimeter. Okay, thank you.
这是气管旁这里啊。
And continue injection fluid, right?
Yes.
It should be completely separated between the tumors and the tissues and vessels, right?
Yes.
有吗？ Yeah. 啊，对。
That means the tumor is captured by the
主要是
liquid.
主要保护核板神经。
Is to protect the recurrent laryngeal nerve.
Okay, now looking the now looking. This nodule is isolation 核板神经 recurrent laryngeal nerve 气管
Trachea.
Trachea, right? Separated
Yes.
from the trachea.
That's,
Where the esophagus? Where the esophagus? It to be closer to the trachea and esophagus.
We
They separate.
puncture to
But
put
the
the
nerve
antenna
and
into
the
the right
vessels.
position.
Looks hard puncture.
Yeah,
Is it hard? Looks hard, right?
a little bit.
The tumor is moving,
正
right?
在 largulent.
Okay, it's good. Got in.
We've already started ablation.
335吗？
The power was set at 35 watts.
我看一下。
Are we using 16 gauge antenna for the ablation?
Yeah.
Yes.
Okay, thank you.
还好吗？潘美美，还好吗？好。Okay, this patient.
Maybe you need another needle, right? The first one is in the place. You need another needle?
No, we only use one piece antenna.
One?
Yeah.
Just one, right?
Yes.
OK。对，好，我们
Okay, this nodules is finished.
它那个消融洞已经覆盖了这个结节啊。The ablation zone is覆盖的嘛？Over the cover over the nodule.
Dr. Chen, you already finished the
Yes,
ablation?
we've already finished the first nodules. First
You
nodule.
might tell us how many minutes? How about the power?
The power
you
is 35 and the
还好吧？
time is 55
讲话。
seconds.
好，
55
这个患者
seconds.
的声音也是好的哈。
Yes,
Near
and
one minute, 55 seconds, and 43 power.
35 words. The power
多
is
少 minute 可以，好
35.
吧？
35 watts.
Yeah.
And
the
timing,
patient's condition
how many
is
seconds?
55 seconds
55
totally.
seconds.
Yeah.
Okay, you check the result.
Yeah, the patient condition is good.
No pain, right?
Yes, and the voice is well.
"对，第二个和第三个啊。对，同时做，我们一个点。
The second nodule?
对
Yes, we
second
will
and
do the
third.
second and third nodule together.
All together, right? You puncture second and third together, right?
Yes.
Okay, how big of the nodules? How big? How big of them?
一个3厘米，一个2厘米。
One is 3 centimeter and another one is 2.
Oh, 2 and 3 centimeters
Yes.
respectively. Okay, 2 nodules. And puncture together, one
Yes.
and then another. So you should pay attention to the angle, the needle puncture direction. You see the direction? You see that? Yes?
Are we doing hydrodissection now?
Yes.
Okay.
你就回答吧，你有什么不懂的问我。好，生理盐水，生理盐水再准备一次。
Can I ask how much saline would you need to do the hydrodissection?
大概要多少的那个盐水去做这10个隔离
40毫升。
40.
40 milliliter. Okay, thank you very
Yeah.
much.
You're welcome.
Continue injection liquid. Total 40 liquid, 40 milliliter.
Yes, 40 millimeter.
来，再给我生理盐水，稍微有点点疼啊，不要紧啊，就这一针有点疼啊。
Dr. Chen should injection more liquid is better to separate the tumor and the tissues, and clearly to, separate them.
啊？对对，yeah。
Now we puncture the antenna into the nodules.
Oh, 你看这个结节啊，周边有点钙化，我们通过没有钙化的地方进去，开始消融。
And we start ablation now.
Okay.
消融呢是从后向前消融。
The ablation, we do the ablation from the deep to the close.
From the distance, right? First.
Yes.
And
通过
then
这两个结节啊，
backward, and then
这也
ablation
是先
again.
消融
Right?
后方的这个结节啊。对，先到后方，
Yeah.
对，
We do short, moving shots
先往下面一点，放
ablation.
松，没事啊。好，这个结节就 OK 了。
Okay, this nodule is finished.
后方的这个结节已经结束了啊，
The deep one is finished.
进行第三个结节，收第三个结节消融。
Okay, now we ablate the third nodule.
方妹妹，好，声音蛮好的啊。
We are check the patient's condition.
The voice 对。这三个结节啊，就是消融顺利的话，我们呢会把那个还有几个非常小的结节一起给它打扫干净。你会翻译吗？
After ablating these three nodules, we'll ablate other small nodules as well.
May I ask what is the ablation power now? Is it same as before 35 watts or it's changed?
Yes, still 35 watts.
Thank you.
35 volts?
Yes.
How about time? Same time? How
Uh,
many seconds?
the second and the third
looks like
together.
according to the, I think the move needle very quickly, and so the ablation time not so long, quite short, right? Because controlled by the
因为
ultrasound.
头像矮一点。
Yes.
"这个过程呢，患者也不感觉到痛 ，no pain。
Yeah. The patient feel no pain during the operation.
That's good.
Yes.
好，肩膀下去一点啊，快好了啊。Okay, this largest nerve is finished. It's finished.
And before you remove the needle, you should check it, right? Is it good or not?
Yes.
No, it's
Okay.
removed. It's follow the
还
procedure.
有这个
Yes.
我们看这个还有一些小结节，我们把它一并消掉。
Here are some very small nodules.
Left lobe.
On the left lobe, we'll ablate them all this time.
对，包括右侧也对了，右侧还有2个小结节。
Also, there are 2 small nodules on the right lobe.
看这一个小的啊，大概8个毫米。
8毫米。
18 mm。
The small nodule size is 8 millimeter.
还有一个6个毫米的。
And another one is 6 millimeter.
我们一起把它消掉，就打扫干净嘛，省得防止以后再长大。因为这个不增加患者的损伤啊。OK。OK，另外2个小结节啊，在右侧翼的已经消融完了啊。
The small nodules in the right lobe already finished.
对，左侧翼的这个结节我们再消融一下。
And we'll do the left one.
带麻药的，对吧？整个过程呢，患者呢，这个非常的这个，应该说没有疼痛，非常舒适，也非常配合啊。好，这是左侧翼的结节啊。这个
麻药是利多眼液吗？
Yeah，
little
是的，
不稀释
麻药是
的
利多卡因，对的，
是眼液不稀释是吧？
不稀释。
用量多少啊？你的总量有多少？
红证能给
第二个、第三个结节好像用了
5毫
40
升
毫，
5毫升，
麻药是吧？
麻药
麻药用的是5毫升。
OK，这是。我们看到这个高回声的气泡覆盖了这个结节啊，就是消融就 OK，对于良性机器来说。
就是你的高回声覆盖了结节，就说明
对对对，
消融好了。
哎，对气泡。好 OK， 造影可以。
所有的结节都消融了，是不是？
Okay, now we see, let's check the. Oh, yeah.
We'll check if we complete all the ablation.
Okay. No, 不要紧，没事。超声造影检查消融的范围的一个这个完全性。
Now we
CES
we use CES to check the ablation range.
没造影，因为等一下，双弧，最下面一个，回来。好，准备，3、2、1，推。Okay, this nodule is no enhanced. 这个线流蛮好的，好，另外这两个机器。Okay.
Looks very good, right?
Okay.
Yes, here's
No enhanced.
Yeah, no
No blood flow.
enhancement.
Yeah. Okay. Three large nodule. There
Large
is
one
not,
is, I think is good. Large one very good. How about other nodule, small one?
yeah. Okay.
Yes, very well.
OK，这个小的机器都，也消掉了，这是 OK。
There is
This
some
is
still some image, right?
left
Enhanced.
small nodule is not enhanced. Okay. Left. Okay. The 5 nodules is completely
Completely ablated.
ablated. Okay. Okay, this operation is over.
Yes.
潘美美还好吗？好的。
And the patient's condition is very well.
Now I is communication with the patient. His voice is fine, and she have not feel pain. Okay, this operation is good. 好 ，OK， 回来，因为
Okay, that looks great.
Yes, the case is finished.
我们一共做了5个机器啊。
We totally ablated 5 nodules.
主要调暗，调暗。好，可以切了，好了，一共5个机器，好，好，写一下啊。